While there have been declines in tobacco use among youth, e-cigarette and vape use among middle and high school students has been on the rise. The popularity of these items is of concern for health professionals, educators, and parents, in part because of the common misconception that these products are harmless.
So when someone vapes, it doesn't produce a tobacco smoke, it produces an aerosol. And these aerosols can carry solid particles with them, and those solid particles are often those toxins that get into your body. So some of those toxins may include nicotine, which we know the effects of nicotine are harmful to an adolescent brain. The nicotine also can lead to addiction. There's also vegetable glycerin, and that chemical is made in like cosmetics and it's put into food, but it's not really meant to be inhaled into the lungs. There's other chemicals such as a few different kinds of metals, formaldehyde, diacetyl. If you've heard the term popcorn lung, that's the chemical that's responsible for the popcorn lung, and arsenic as well.
According to the New York State Department of Health statistics, 27% of high school students in New York State are now using e-cigarettes. High school use in 2018 is 160% higher than it was in 2014. And the increase is largely driven by flavored e-liquids. There are over 7,500 e-juice flavor options that are used as a marketing strategy to lure new customers. For example, flavors such as mango, banana, blueberry, muffin, and apple pie.
So the concern over these is that they're not regulated by the FDA, the Food and Drug Administration. So there's no regulation what goes into these substances or no regulation on where they're made. And also with the different flavors that they have of these, they're really targeting towards youth, right? With all the delicious sounding flavors and like the colors and the packaging they're using.
With e-cigarettes or vapes, a consumer can purchase an e-liquid with varying amounts of nicotine, which is sometimes misleading.
If on the box it says 0% nicotine, what we found is that when those juices were tested in the laboratory, they were still found to have nicotine in them. And of course, that's what causes the addiction. So, it's a way to keep their customers kind of coming back. So just because it's labeled 0% nicotine, many times that's proven to be false.
In August 2019, the New York State Department of Health released a health advisory to inform professionals of an emergency threat of severe pulmonary disease associated with the use of vape products. The number of vaping-related illnesses jumped to at least 450 cases in 33 states, according to the CDC, with at least 6 deaths linked to vaping-related respiratory illnesses.
So the biggest thing is to educate yourself. So educate yourself on what they look like, the different shapes, the different kinds, the different sizes. So when you see one, you know what it is. Talk to them about the risks, about what you know. Show them, look things up online with them and show them what the media is saying about these. Educate other adults. Adults aren't all knowledgeable about what's going on. They may see some false advertising as well. So it's important to talk to other adults and share that information on what we are seeing. Set a positive example, right? You can't be talking to a teenager about vaping and then you're vaping yourself. So it's important to set those positive examples. There's new findings in the media every day, new information we're learning, new health effects, so just keep an eye on that.